So another thing I'd like to talk about that relates to integrated care here is how we're going to be handling tobacco dependence. Um, this has been there's been a lot of ambivalence about dealing with tobacco dependence in mental health organizations, both inpatient and outpatient, over a long period of time. And one of the most important things to understand is that the reason for this is because the majority of people with significant psychiatric illnesses smoke, even though smoking has a far lower prevalence in society in general than it did several years ago. This needs to be addressed for a few reasons, but the first reason is that we've been addressing substance use disorders to a greater extent in recent years because of the opiate epidemic, because of the toll taken by alcohol dependence, because of the crack cocaine epidemic of many years ago, and other problems that have existed. And for whatever reason, tobacco has always been in a kind of an in-between category or another category. It hasn't necessarily been thought of as a substance use disorder in the way that opiate dependence has. And we've come to think that this is wrong, and the reason that it's wrong is because, tobacco dependence, nicotine, the active ingredient and the addictive ingredient in tobacco, is every bit as addictive as any of the other substances, including opiates. Very difficult to quit. And tobacco, which has a number of carcinogenic and many carcinogenic and noxious chemicals in it, really is as deadly, if not more deadly, than any of the other substances we're talking about. And because the prevalence is so high, it's likely that tobacco takes more lives and takes more years of people's lives, causes more disability than the other substance use disorders together. One estimate is that our patients lose 10 years off of their lives if they smoke from the time they're adolescents to the time of their death. And 10 years, that's really a long time. We talk about people losing 25 years off of their lives if they have a serious and persistent mental illness. Well, we're talking about one substance use disorder, as I will call it now, that accounts for nearly half of that. So if we're going to be serious about helping people to reduce morbidity, reduce mortality, improve quality of life, prevent certain diseases, we have to take on the issue of tobacco dependence, difficult though it may be. One of the difficulties in dealing with it, as well as in dealing with alcohol dependence, is that it's legal, right? So it's not stigmatized to the same extent as other substance use disorders. Although in recent years, tobacco has been less tolerated in a variety of settings and has been somewhat more stigmatized. I think stigmatization is really not the issue here. The issue here is helping people to quit and understanding that we have better tools, better strategies to help people to quit using tobacco products than we had in years past. Just like with alcohol and with opiates, we have medication-assisted treatments that can help in addition to non-pharmacologic therapies. Same thing exists with tobacco. We have a number of highly effective medication-assisted treatments, and we also have a strategy here at CHR that involves a series of two different types of groups that people can attend, one where they're thinking about quitting smoking and another where they are quitting smoking. We have to help with this. We can also apply our harm reduction model, which is, people don't have to quit straight away. What they can do is they can reduce their use, which can be helpful, right, and help them to quit later on. But the idea of just saying that, somebody is going to smoke a pack or two a day, they're going to come to us for help, and we're going to help them again with their depression, help them with their voices, help them with their obsessive thoughts, and have some success there, and that they're going to die of lung cancer or heart disease when they're 45 or 50 years old. Again, Pyrrhic victory, not exactly where we're hoping to go. So we're going to make this a major leg of our integrated care program, and we're going to be helping people with these issues, and we're going to be hoping that there's going to be less prevalence of tobacco use disorders, use of tobacco products, and as a result, people are going to be healthier, living longer, lower risk of a whole variety of cancers that come from tobacco use disorders and cardiovascular disease. And that, I think, is something to look forward to.